Imagine feeling deeply connected to your partner, wanting closeness and being emotionally ready for intimacy. Yet, the moment you try, your body seems to resist. Instead of comfort and openness, there is tension, pain, and even the sense that an invisible wall has been put in place. This painful reality has a name: vaginismus. Hi, I'm Dr. Behnaz, a pelvic floor specialist, and in this video, I want to help you understand what vaginismus really is, why it happens, and most importantly, how it can be treated, because you are not alone in this, and recovery is absolutely possible. Vaginismus is not about lack of desire or control. It's a reflexive tightening of the muscles around the vaginal entrance. These contractions happen involuntarily and they can make penetration painful or even impossible. For some women, this has been present from the very beginning. This is called primary vaginismus. For others, it starts later in life after painful intercourse, childbirth, surgery, trauma, or menopause. This is secondary vaginismus. Women often describe burning, stinging, or a feeling as if a wall is blocking entry. Some can't tolerate tampons, others find pelvic exams impossible. Behind the body, vaginismus takes an emotional toll. It can create fear, shame, and a strain on relationships. In many cultures, vaginismus is one of the most common causes of unconsummated marriage. This condition is best understood as a protective muscle reflex. Just like you blink if something comes close to your eye, the pelvic floor can contract when it anticipates pain. For some, this reflex is learned after a painful first experience or traumatic exam. For others, the pelvic floor is naturally overactive, always on guard. Anxiety and fear magnify the tension. Hormonal changes, infections, or conditions like endometriosis can add physical pain that reinforces the guarding. The cycle continues. Pain leads to fear, fear tightens the muscles, and tight muscles cause more pain. Healing, however, is possible. It starts with knowledge. When a woman understands that vaginismus is not her fault, but a muscle reflex. Education and reassurance are always the first steps. From there, we focus on calming the nervous system. Breathing exercises, mindfulness, and body scanning teach the muscles that they don't need to stay on high alert. Guided relaxation practices help interrupt the pain, fear, tension cycle. Hands-on therapy can then make a big difference. With gentle internal and external techniques, a therapist may release tension in the pelvic floor area, mobilize tight fascia, or treat trigger points along the vaginal wall and pelvic floor. These approaches restore flexibility and help desensitize painful areas. At the right time, we may introduce vaginal dilators. This is never about forcing penetration, but about retraining. We start with the smallest size, pairing it with slow breathing and a sense of safety, and gradually progress. Over time, the muscles learn that penetration can happen without pain or fear. Pelvic floor retraining with biofeedback is another key tool. With sensors or visual feedback, women can see their muscles patterns on a screen and practice learning how to contract and then completely relax. This builds awareness and voluntary control. Sometimes treatment also involves supportive approaches like lubricants to reduce friction or topical estrogen in menopause women if vaginal tissue is thin and dry. These simple measures can reduce pain and allow therapy to progress more smoothly. Healing also has an emotional dimension. Many women benefit from psychosexual therapy where fear, avoidance, and relationship concerns are gently addressed. Involving the partner when appropriate creates understanding and support, making progress more sustainable. Some programs also include movement based or functional exposure, practicing comfort in different positions, and gradually building confidence during activities of daily life, not just in the clinic. One patient I work with could not tolerate even a cotton swab at first. Her anxiety and fear made her muscles clamp down instantly. Over time, with education, breathing, gentle manual therapy, and the smallest dilator, she progressed step by step. Months later, she was able to complete a physical examination with her physician comfortably and return to intimacy with her partner. Healing is gradual, but every small victory matters, whether it's inserting a fingertip, tolerating a small dilator, or attending a pain-free exam. These steps add up and eventually intimacy can return without fear. If new symptoms appear like unexplained bleeding, discharge, or severe pain, it's important to see a medical provider as sometimes vaginismus occur alongside other conditions. But the big message is this: vaginismus is not permanent. With patience, structured therapy, and the right support, your body can learn to relax. Your muscles can learn to trust again, and intimacy can be pain free. You're not broken, you're protecting yourself. And together we can retrain that protection into freedom. If this video helped you, please subscribe to my channel, click the like button, and share this video with someone who may benefit. And don't forget to turn on the notification bell so you never miss the next pelvic health topic.